Good afternoon. My name is Dr. Muyi Aina, and I am the Executive Director of the National Primary Healthcare Development Agency in Nigeria. I bring you warm greetings from Abuja, where it is bright and warm today. I would like to start by thanking the Health Campaign Effectiveness Coalition for your leadership and for continuing to push the agenda, which is not only improving the quality of our campaigns, but also making sure that we achieve efficiencies and save time and resources as we deliver multiple interventions. As co-chair for Nigeria's Collaborative Action Strategy, which is operating under the Health Campaign Effectiveness Coalition, I am quite proud of the strides we are making and some of the early successes and lessons that we are learning as a result of our collaboration. For the first time in history, we have implemented an integrated campaign of multiple interventions, some of which were originally anchored by the Federal Ministry of Health, and some were anchored by the National Primary Healthcare Development Agency. Through the collaborative effort of the two institutions, as well as the states and implementing partners, we have been able to now demonstrate the feasibility of integration and co-delivery of services, which include the measles rubella vaccine, the polio vaccine, the human papillomavirus vaccine, as well as routine immunization antigens, alongside treatments for non-neglected tropical diseases, NTDs, and malaria. In the three pilot states of Kano in the northwest, Yobe in the northeast, and Oyo in the southwest, I will share a few of the results that were achieved in the October integrated campaign. For measles rubella, we reached 90% of our target children in Kano, 97% in Yobe, and 98% in Oyo. And these are numbers that have been corrected for any errors or inflation. We also reached 1.4 million people reached in 6 local governments in Kano for onchocerciasis, 659,000 people reached in 2 local governments in Oyo for lymphatic filariasis, as well as over 353,000 people reached in the 2 local governments in Yobe, where we incorporated treatment for trachoma. Through these integrated campaigns, the country has now been able to maintain a strong coordination structure with multi-sectoral representation, which has fostered shared ownership and accountability. We've also demonstrated for the first time that the cross-planning that is collaborative across FMOH, the Ministry of Health, and the National Primary Healthcare Development Agency, which has minimized duplication of effort and helped us to move faster and more stealthily in our interventions. We have showcased greater stakeholder and community engagement that demonstrates the synergy of the government in delivering health interventions and driving demand for services being delivered, being that this time we leveraged capabilities across the multiple programs for our community engagements. The integration also ensured efficient drug and vaccines tracking, as a result of which, for example, the azithromycin supply chain was accentuated so that the drug was made available despite any risks of not being ready for the campaigns. The integration also strengthened data, as we had real-time data monitoring and verification across multiple programs that also enabled us to cross-triangulate data on target populations, which that make corrections where it was appropriate. We also learned a few important lessons, which will guide us as we move forward and plan towards 2026. Integrated delivery clearly improved vaccination uptake and mass drug administration coverage, because the integration that incorporated interventions for different members of the family. We had something for the baby, something for the mothers, something for the older children, really better matched the felt needs of the population that we were serving, and incidents of rejection or pushback were minimized. We also found that early engagement with non-health sector actors, especially the communities and the ministries of education, allowed us to intervene in different ways. For example, the school-based campaigns were very successful with minimal resistance. One of the things that we also learned is because we were implementing multiple interventions at the same time, we needed to build in more robust training programs. And we need to really focus on making sure that the different programs come together to deliver a high quality training, given that we're sharing resources and personnel. The use of role plays really helped the vaccination teams to grasp, the principles and the approaches that they needed to take to reach the target population with mass drug administration, as well as vaccination with several antigens. In all, we are absolutely looking forward to moving the agenda forward and learning more and sharing with the collaborative as we implement the second phase of our measles rubella campaign, as well as soil transmitted helminths integrated in early quarter one, I believe January and February. Nigeria is proud to be a global pace setter for health campaign effectiveness, and we look forward to moving ahead with this agenda with all of you as our partners. Thank you.